from the DataLEADS and so far ADiRA, Nazakat Sir, Urvashi ji, Venkate ji, Dr. Khalid, our dignitaries, Dean Medical Faculty, Chairman of Skill Lab, Professor Bishak, Professor Simona, Professor Munir, Professor Roof, Professor Kurku, and Professor Akbar and several other faculty members, scientists, scholars, students, boys and girls. Good morning and welcome to this important initiative at SKIMS. I will be candid in expressing my gratitude that rather than us reaching a very important data company, which was now made, it is marked not only in India, on a global platform. They reached us. They came and they said that we would like to collaborate with you. And before I would think second word, I said, okay, this is what I am looking for. You must have seen that in my earlier speech when I took over, I was thinking that SKIMS being a tertiary care institution with huge responsibility of academics and research, with patient care as a byproduct of both these activities, and also looking at the data sets which we have in our repositories as well as the data which we generate on hour-to-hour and day-to-day basis. We thought that we are losing our treasure, our gold. It is just withering away. We do not know how to use this. And that time I was thinking that world trillionaires today are coming from data. Today, whatever the biggest treasure, biggest industry is the data. That's very important. We have to realize that. I have said it earlier, I may be repeating it, but for those who are new here, they have to understand my mind that if we want to excel in our mandate of this institution, whether it is a high-end skill, manpower generation, whether it's a high-end skill treatment to be given to the patients, whether local or from outside in terms of the visitors or pilgrims and so on, we need to go to the next level in all the three objectives. How can we go to the next level is that we have to bring precision in our day-to-day algorithms, protocols, clinical other algorithms have been devised by institutions of opinions globally. Most of the time we adapt US protocols, UK protocols. Very rarely we generate our own. But all those protocols, if you see, need precision, need accuracy, and we need to have a contextual modification. We cannot just copy them and introduce here. It may not work. Today morning we had exam for BM students. We had this, what is called stand-up exam. So I had introduced this new subject of ethics and communication skills. So I told my department, so we adopted a book somewhere. So there were a lot of points written, and there was one algorithm that you have to, how to reach a station. So I thought it will not apply to us because we don't have a station. What station? The railway station, we have one normal station, anybody can reach by closing your eyes. The network, railway network in our population is not as difficult as it is in New York or as it is in UK. So we cannot simply adopt their protocol. Looking for a station, you will score 5 marks. No. Here, you don't need to score anything, you will reach up your own. So we have to modify all these things for our contextual issues. That is very important. About what Nazakat Sahab was saying, large language models and machine learning, artificial learning like deep machine learning, we have several other protocols which have now come up in research. Research is the most important thing in medical, where we will be getting benefited by data. For patient care, algorithm adoption, it is definitely that a human interface is required. You cannot, because it's an artificial intelligence is coming up in a big way, but we are in learning phase, ethics will come there, sometimes what is called artificial idiocy may come. We don't know, we are talking of intelligence, but artificial idiocy may come tomorrow. We may do mistakes, errors may come in. So there human interface is mandatory. But I know when you have less manpower, like we are at this moment 40% of our staff. If we had AI, if we had these protocols, we would have not been in so much of hardship. One professor would do the work of 10 professors. Or one classroom, one person would teach, he would benefit so many students. So actually multiplication of benefit in clinical practice and teaching, learning, of course the AI will go a long way in helping us. But we do, since it's a new area for us evolving, we need to see that we are not ended up with ethical, muddling the ethical borders, we are not muddling with, we are not creating errors, we are not, because tomorrow if we do an error, and the litigation comes up, whom will you sue? Will you sue a machine, artificial machine, or a doctor, or a paramedic? Those issues will come up. These are practical difficulties we have. Having said that, teaching, training, skill. For example, the skill lab is doing so many programs, as well as the generation of data research. AI will have a major role, 90% of the role will be there. We only need to marry our skill, our doctors, our manpower, healthcare workers, their skill with the machines. So two interface is a little tricky, and two together, what I can call as combined intelligence, or something supra-additive intelligence. This will probably be a game changer in health scenario of this country. As Nazakat was already saying, I am well aware that the Prime Minister's mega initiative of introducing AI in India, in a country where we have 1.6 billion population, already overtaken China. We need to have, if we want to benefit each individual, we need to have AI into not only in health, in other sectors also. You must have seen that services, whether it is electric bill paying, telephone bill paying, you have a land record or anything. So how much change has happened in the services because we adopted to the information technology makers. And that way health will also be improved once these models in India will be taken. India has an edge because you must be knowing that the first computer, what was called lab in Hyderabad, that was called, I think, Silicon City. And we were students that time. So I had gone as a student to Hyderabad, I was taken to visit Silicon City. And that time, we were not knowing what it is. Those are the engineers who went out abroad. They brought change not only to the image of India, they brought change worldwide. The other day I was reading in JAMA editorial. One Indian doctor, Indian scientist, named Atul Bhutti, you must have heard of him. He died, and JAMA wrote a commentary as well as obituary for him. And there were 1,000 programs, condolences held in Mayo, MD Anderson, Harvard, for him, he had actually introduced AI in health there, and he became such a big person. He succumbed to cancer, unfortunately. But Atul Goti was so famous, he was from India. So that is what I am telling you, that we were not doing those days. It has come to us little late, but nevertheless, better late than never. Generated, the ideas generated from this country, went abroad, got validated there, now we are accepting it. It would have been nice if we had accepted and experimented ourselves and given to the world. Lot many things can be told about this. I was reading someday that I forget the name, some therapist wrote that a year in AI will make you understand how about the existence of God. When you understand this AI and these all those things, then you understand that there is something what is managed by Allah, God, Bhagwan, whatever you say. That somebody, some supernatural power is managing things. It is easy for him to manage. But when we can manage by a machine so many things, why can't he manage the whole globe? Galaxies, astronomy, and health, and thinking, and understanding of anybody. So the more deeper you go into it, more closer and more closer you go to the supernatural power. So we have to understand that aspect also. Again, other day I saw one study that those people who use more AI, they have atrophy of hippocampal area. So it might be the other side of, downside of it. And that means when we are using AI, when we are coming to machines, when we are getting newer ideas, the human being is itself going down. And that is what must be Allah wanting us to stand up on the doomsday when we don't have our own brain, other instruments, other programs, softwares, and these will come and speak on our behalf what we were doing in our lives. So, I'm just saying, as days pass on, we might get some new things. Probably we're losing control. Humans are losing control. The Ashraful Makhlukat has the power on everything. We have made control of everything in the world. Now we made an instrument which will finish our existence, and that may be the doomsday. This is what I understand from whatever is available nowadays. Maybe in future things change. Having said that, that is the other side of it. But today, SKIMS stands for technology improvement for common good to public, non-specific good to humans. In that direction, I assure DataLEADS that we will give full support to your initiative, and whatever is possible in our administrative hierarchical system, we will be giving you full support. In fact, I want to tell you that we have now a dozen of medical colleges in the region of J&K, and we are looking at improving their services. For example, recently we had a meeting where we will be doing teleradiology with them. We will be having tele-ICU. For example, our ICU here will link up with their ICU. Our doctor will advise them what parameters, because their monitor, whatever is displaying there, it will display to my critical care specialist. He can give them advice. Yes, it is happening like that. You can change your treatment and all that. So this tele-ICU, teleradiology, and several other services government is introduced. And SKIMS has been given the responsibility to mentor those institutions. And with that direction, I think all these medical colleges, you can have a program next time where we can get some representatives, faculty who are interested in AI, and faculty, even students who want to specialize themselves in this area. They can be kept together and a very exhaustive workshop can be done so that they become the leaders in healthcare with AI tomorrow in our area. That's point one. Point number two, I would like to say that we have almost 30 years data in some departments. For example, pathology was telling me the other day we have slides and biopsy specimens are 30 years. We have other clinical data of 2 decades, 3 decades, 4 decades preserved with us. We would like to harp on that data. We would like to see how we have managed patients, what has been happening there, and now how can this data be used for the understanding and giving the algorithm, giving guidelines, not only for our population, maybe it may add to the global data. Not many places will have such a good data in this country. In New Delhi, where I worked for more than a decade, we do not have a data repository as robust as SKIMS has. We have some good points also. That's point two. Point number three, I would like to say that we have already put down an expression of interest regarding making a department here. I don't know what we named that. We arbitrarily named that department as Clinical Data Repository and Health Information Exchange. But we are open to modifying the name because some brainstorming is needed for that. So we have put an expression of interest. Any faculty who's desirous of becoming a what is called founder head of department will give CV, we will have interaction, and we will give this department to somebody so that that person leads this program and we have a institutional proper department by governing body. This I am looking at it. I have put expression of interest for 6 or 7 departments. One of them is this department. Why I put it? Because we realize what is the strength of clinical data, and we definitely need to train our doctors, paramedics and specialists in this data. Otherwise we will be tomorrow feeling very bad when the protocol, when AI will envelop the whole system. That time we will be feeling very redundant. So we have to catch up as early as possible. So with that, I thank and congratulate Skill Lab and its members, Dr. Ejaz, Dr. Mudassar, and I also thank ADiRA Initiative from DataLEADS for coming here, starting this program. I wish best of luck for this program, and I also lay our cooperation open to your suggestions, and you can give me whatever suggestion you are that. I will constitute a committee and see how we can have this collaboration meet some national international standards. Thank you so much.